Hey guys, it's Louis here from ndxtesting.com, the channel where we try to give you medical care solutions and bring you diagnostic digitized information so you and your family can be healthy. Now, in today's video, we're going to speak about what happens when you wake up in the middle of the night in panic mode. Perhaps you wake up out of breath, or maybe shaking your head, and you're able to tell there's something is wrong and you just can't pinpoint it. And now, it seems like that's happening to a lot of people because I posted a video stating how I discovered or how I was able to cure my high blood pressure and anxiety and the reasons why. And one of the reasons that was happening to me is because I had those same symptoms. Now, the first time this happened to me was in the year 2007. I woke up and I was waking up in the middle of the night in panic mode, but most of the time that was happening, I was on my back, sleeping on my back, and I would suddenly wake up in panic mode and sometimes out of breath, or usually always out of breath, shaking my head just to kind of catch my breath. And I never knew what that meant until it peaked in 2017. So it seems like that situation is happening to a lot of people. And I didn't know why that was happening to me, especially when it peaked in 2017. Now, if this is happening to you, and these symptoms that's happening to you in the middle of the night is causing insomnia, or is causing depression, or perhaps you have anxiety, or maybe you have high blood pressure, or maybe you have a fast heart rate. Well, I want you to relax yourself a little bit because I'm going to tell you exactly why this is happening to you. Now, like I said before, when it happened to me back in 2007, it will happen like maybe once or twice a year, and I was much younger. So when you're much younger, you're able to deal with things a little better. Now, at one time during those times back in 2007, maybe 2008, I did catch a little bit of anxiety, maybe a week or two. It's the first time that I felt a little weird when it came to my body, and I shook it off. I used to dance a lot. I used to exercise a lot. I used to walk a lot. So I shook it off, but I knew that something was wrong. And then even back then, I think a physical therapist took my blood pressure and it was a little high, but I dismissed it. I didn't really pay no mind to it. But something was developing and I didn't know. I was doing something wrong with myself and I didn't know. And I'm going to explain to you exactly what's going on. So if this is going on with you at this particular moment, if you're waking up in the middle of the night in panic mode, if you have insomnia, or you have anxiety, or you have high blood pressure, you have these symptoms and you do not know why, and they cannot give you the answer why. Well, you might have what you call sleep apnea. Now, what is sleep apnea? Now, sleep apnea is when your airways get compromised when you sleep. And you wake up suddenly when that happens. So when you're sleeping, most of the time it happens when people are sleeping on their back with their mouth open and they're breathing through their mouth. Somehow your airways collapses and your tongue kind of just falls back and you don't get enough air into your brain or your central nervous system, into your body, and you suddenly wake up. And you have to wake up because if you don't, then it could be a huge problem. So that's why you wake up the way you wake up. Now, and when that happens, people are usually sleeping on their back with their mouth open. Now, sleep apnea attacks 3 different kinds of people. Now, when I first told a lot of medical professionals, and I'm in the medical field, that I had sleep apnea, they were like, that's impossible because usually sleep apnea, it attacks people, it affects people that are overweight. But not just overweight, but people that are obese. Usually people that are overweight, they have a problem breathing. It could come from their throat or perhaps even their nose. There's some obstruction when it comes to the inner airways of your throat, of your lower jaw, and then the nose. In the nose, you can have a deviated septum. You can have some obstruction going on. You cannot breathe, and then you get diagnosed with sleep apnea, especially when you're obese, and they give you one of these CPAP machines. But it happens to a lot of people that are overweight. But it happens to other people as well. Okay, so if you're overweight at this particular moment, well, I'm going to tell you some solutions, but obviously you have to you're going to have to lose some weight in order for you to have some benefits, some of the treatments that I'm going to give you. Another type of individual that this happens to is people that they look fine, they have good structure, but for some reason they develop a severe deviated septum. Some obstruction happens in the nose, and when that happens, then you can't breathe through your nose, and then you somehow become a mouth breather. And when you go to sleep, maybe you're sleeping on your back and you're sleeping with your mouth open, the airwaves kind of collapse a little bit, your tongue kind of falls back. And it's important too that we understand that when we sleep, the correct way of sleeping is we have to have our mouth closed. If this is the roof of your mouth, you have to have your tongue. Actually, let me do it from my left side here. This is your tongue, and this is the roof of your mouth. Tongue has to be flat against the roof of your mouth. What happens is when the tongue just kind of falls back a little bit, just kind of dangles a little bit and just falls back, then it can block the airways, and then you wake up suddenly gasping for air because you're not sleeping properly. Maybe you're sleeping with a flat pillow. The correct way of sleeping, obviously, like I said, is have your mouth closed, good tongue posture, and then a little elevator on the side. Or even if you sleep on your back, you have to sleep a little elevated so this does not happen to you. And so another type of individuals that this happens to, it's people like myself. Now, you might look at me and you'd be like, what's wrong? Now, I have what you call a overbite. So when you have an overbite, what happens is that your bottom jaw, it's all the way back. So when your bottom jaw is all the way back and the top is kind of falls forward, your airways get compromised a little bit, and you have a narrow palate. So that could be happening to you. So you could be overweight and you have a lot of fatty tissue. Maybe you're not. Maybe you have a good bite, but you have a deviated septum. Or if you're like me, then you can have an overbite, and when you have an overbite, your airways get compromised. Or maybe you can have a mild deviated septum. You can have a combination of both. So I'm going to tell you how you can correct these things and the things that you can do. But if you're waking up in the middle of the night, gasping for air, choking, and you have anxiety, you have high blood pressure. Now what you need to know is that sleep apnea causes high blood pressure. Sleep apnea causes anxiety. Sleep apnea causes a fast heart rate. And if you don't control your sleep apnea, it keeps on going, and they don't diagnose it and they don't treat it, then you can end up with cardiovascular disease. You can end up with diabetes. You can then end up with heart disease. There's a lot of things that can happen. So you have to be able to control that. Now, when I went with these symptoms back in 2017, when they peaked, I was anxious and I was not feeling 100%. I went from being 100% healthy to overnight feeling like something is going on with my body. And I went with these symptoms to the doctor's office, and I'm telling them what's going on. I'm waking up in panic mode. Something's going on with my sleep. I'm pretty much spoon feeding them the information. They couldn't tell me why was going on. Now, when I have anxiety and my blood pressure is like 180 over 100, and I have a heart rate of 110, they basically said I'm having some sort of panic attack. And since I look perfectly healthy, in their mind it's psychological. Maybe I need a psychiatrist or something. And I'm explaining to them like nothing's wrong with me. It's not my mind affecting my body. It's my body affecting my mind. There has to be a reason. Their logic was, well, you don't have to have a reason. You could be a genetic disposition. Your mother could probably suffer from high blood pressure. Your father could maybe suffer from from anxiety. Maybe you're getting it from them. And I'm like, the way I understand medicine is this, that no matter what happens to you, 90% of the time, there has to be a root cause. Now, there's a lot of subscribers and there's a lot of people in the channel now that they think that I'm a doctor, and I'm not a doctor. When I introduce myself, it's Louis from NDX Testing. NDX Testing is my company. You can go to ndxtesting.com and you can see my website. Now, I'm a registered technologist in the field of electrodiagnostic medicine, so I specialize in doing nerve examinations. We do nerve and muscle examinations all the time, and we do other types of neurological studies. So I have deep understanding when it comes to the peripheral nervous system, which is nerves and muscles. So when you have good understanding of the peripheral nervous system, you have to have good understanding of the cardiovascular system. Cardiovascular system is composed of arteries and veins. And then you have to have also a good understanding when it comes to the autonomic nervous system, the central nervous system. Okay, then you also have to have good understanding of the spine, because you have this, you have nerves in the spine. The neck, which is the cervical spine, the middle back is the thoracic spine, the lower back is the lumbar spine, and after that you have the sacrum. So you have to know how the central nervous system, which is the brain, communicates with the extremities, which is the arms and legs, and that happens through the spine. So I know a lot about tendons and ligaments and bone structure when it comes to the body. So when I look at the body, I look at the body a little bit different than perhaps maybe a physician does. The physicians, for the most part, they look at the body, and when they see problems, they want to treat the symptoms. Well, obviously you need to treat the symptoms, but when I look at a problem, when I looked at my problem, I'm like, what's the root cause? See, whatever happens to you, there has to be a reason. So when I'm all of a sudden, I have high blood pressure, I have a fast heart rate, and I have anxiety, I'm feeling like I never felt before. The high blood pressure is a little bit different because you don't feel anything. That's why they call it the silent killer. The fast heart rate, if you have a fast heart rate, if they're chasing you down the street, your heart is going to race. Something happens where you're being chased and you sense danger, your heart is going to race. And when you're anxious, that's exactly what happens. So I knew something was off. And I knew something was wrong with my body. I just did not know what. Now, what was happening, somehow along my years, I started mouth breathing. And if you look at one of my other videos, you're going to learn that mouth breathing is no good. You need to breathe through your nose. You can't breathe through your mouth. If you breathe through your mouth, you're going to get sick. So the air that you breathe has to come through your nose, not through the mouth. You can look back in one of my videos, I explain to you exactly what happens to mouth breathers, how it can affect a child. In fact, so many kids that I see sometimes, and they have asthma. If you're a mouth breather as a child, you can develop asthma. If you're a mouth breather as a child, it affects the shape of your face, the way your face is developed, and you develop crooked teeth, you develop an overbite, you develop so many issues. I was not an exception. I had a lot of problems with my teeth growing up. I developed gingivitis, I developed an overbite, and then if you're a mouth breather, then you can get sick. Mouth breathing leads to sleep apnea, and then sleep apnea leads to a lot of different problems. So now that you know what sleep apnea is, and you can go back to my channel, I have more information on that. I just want to focus on the part that you wake up in the middle of the night choking, gasping for air. What can you do? Okay. Now, one of the things that you have to do instantly, right, is you have to change positions of how you sleep. You cannot sleep on your back, perhaps with a flat pillow with your mouth open, breathing through your mouth. And this is happening to you for the most part, you're breathing through your mouth. You need to keep your mouth closed, and you need to breathe through your nose. And during the day, you also need to breathe through your nose. What you could do during the day is keep your mouth closed, put your tongue on top of the roof of your mouth, and you practice that, always breathing through your nose. The best way to breathe is not all these wild breathing techniques that people teach you. It's nice and collective. Nice and collective, where people don't even know that you're breathing. That's how breathing is supposed to be, nice and quiet. Just like in the animal kingdom. When you see let's just say a lion or a tiger just breathing out of control, no, nice and collective. And they have the most amazing teeth. And there's no dentist in the animal world. So your body needs oxygen, and the right type of oxygen that it needs is the oxygen that comes through the nose. The nose can filter a lot of impurities, and it cleans the air before it goes into your system. If you breathe through your mouth, you're going to get sick. And I was getting sick. I was a mouth breather all my life, and that caused me sleep apnea and the high blood pressure. And there's a lot of subscribers, and there's a lot of people this is happening to, and that's why we're going to make a few more videos when it comes to this, and then many solutions. So like I said before, sleep on the side, sleep a little bit elevated, and sleep with your mouth closed. Now what you need to do is you need to see two types of doctors. If you have high blood pressure, the best doctor that can manage your high blood pressure is not a primary care physician. You can go to the primary care physician, and maybe they can refer you to a cardiologist, and you can go to a cardiologist, and the cardiologist can maybe do a test on you. I recommend that you have an echo. An echo is a study of the heart. They can see the walls of the heart, and they can see if the heart is affected. It's more advanced than having the traditional EKG they do in primary care. But you want a cardiologist to manage your high blood pressure if it's really, really high. If it's not that high, let's just say it's like 140, 150, anything below 160, then you can let the primary care physician take care of that. But anything chronic or severe, very high, like I had it at 190, 180, and these physicians, primary care physicians, they give me some amlodipine with 5 milligrams. I mean, you got to be joking. I didn't do anything to me. It had to be a little bit stronger. And when I'm telling them my symptoms, the correct thing to do is should have sent me to a cardiologist to manage my high blood pressure and maybe do some more advanced tests. And the chief doctor they could send you to that you have to go to is an ENT doctor. Now, an ENT doctor is going to check to see if you have any obstruction when it comes to your throat and when it comes to your nose. Now, in my situation, I didn't have any problems in my throat, and I didn't have any problems in my nose. There's nothing that the ENT doctor could do. There was no obstruction. He said that I have a very mild deviated septum, but there's no obstruction. And so surgically, there's nothing that he can repair. Sometimes you can have maybe enlarged tonsils. You can have maybe some fatty tissue back there. You can have something where the ENT doctor can maybe remove, or maybe there's some obstruction in the nose. They can fix that. But if there's nothing they can do, there's nothing they can do. After that, then they can refer you to a sleep study to see what's going on with your sleep, to see if the situation maybe is suggested for you to get a CPAP machine, which when I found out that I might get a CPAP machine, I do not think so. I'm not getting a CPAP machine. I must connect it. But in my situation, listen, I'm the one managing my health. And since I'm in the medical field, and it's funny because I'm in the field of electrodiagnostic medicine, there's a lot of different fields. This is what I do, which is nerve examinations and EMGs, and I do other types of neurological studies. And then they have EEGs, which is electroencephalograms, to study of the brain and hook up like 20 different electrodes. You also have intraoperative evoked potential, where they do nerve testing in the operating room while the physician is doing surgery. And then they have sleep studies, sleep apnea studies, which I was never interested in because I didn't want to work nights. Now, I knew about sleep apnea and I knew about sleep studies, but I never knew the symptoms. I never knew that when you wake up in the middle of the night choking, gasping for air, where you can't breathe. I would wake up sometimes and I would stumble into the kitchen and I needed to drink some water, shaking my head sometimes because I'm like, if I don't snap out of this, I don't think I'm going to wake up. And it seems like this is happening to a lot of people. It's a silent epidemic that physicians are not picking up. So if this is happening to you, you have to go to 2 different doctors, a cardiologist, so you can manage your blood pressure. If it's high, if your blood pressure is not high, then it's fine. But you need to see an ENT doctor. Also, if you have an overbite like myself, then you need to go to an orthodontist. Now, an orthodontist, and first of all, I want to say that if you have an overbite, for the most part, 90%, you develop an overbite because you will mouth breathe. If you mouth breathe, you're going to drag your face lower. Your face, your lower jaw will be back, and your upper teeth, your upper jaw will be forward. In contrast, when you have a perfect bite, your upper jaw is up, elevating your cheekbones, and your chin is out, creating a good pathway so you can breathe properly. So if you go to an orthodontist, they can fix your bite. You can go from an overbite, if you're young, to a perfect bite. So when they fix that bite, you're going to have expanded airways, and you can fix that permanently. You will never have sleep apnea again. If you're much older, and let's just say they can't move bone around no more, maybe they could fix it a little bit, but you can get a dental device to help you keep your mouth closed. Now, I've had some orthodontic treatment before I had sleep apnea, and since I had sleep apnea, you open your mouth when you breathe. I develop a lot of problems because of that, and I have some bone loss. But I'm doing a couple of things to fix my teeth, and then later on I'm going to go to an orthodontist and see if we can fix my bite a little bit. If not, then I'll get some type of dental appliance. But what I'm doing now in order to fix my sleep apnea, obviously I sleep elevated to keep my room clean. I have a plant nice behind me. I use an air filter sometimes to clean the air. I sleep on the side with two pillows. But what I do to help me keep my mouth closed is that I use some tape, and I'm gonna make a video the exact tape that I use. Okay, and I'll be like, what tape? Well, there's a lot of people using tape to keep their mouth closed. And then I put a little clip on my nose that kind of opens up the airways in my nose, and I sleep nice. I sleep amazing. I made another video of these things that I do, how I treat my sleep apnea and sleep like a baby without a sleep pack machine. You can look at that video. I'm going to post it into the description. But anyway, just to let you know, listen, there's a lot of solutions. If you have this problem, you don't have to worry about it. If you do a combination of seeing a cardiologist for your high blood pressure, if you do have it, and for your anxiety, if you do if you see an ENT doctor, he'll be able to tell you have any obstruction. If you see an orthodontist, he'll be able to fix your bite. Most people that I see, sometimes the subscribers that I see, they're commenting. A lot of them have an overbite. You see an orthodontist, they'll be able to fix that. But anyway, guys, there's a lot of solutions. This channel, it's about providing medical care solutions. And sometimes, when you go to these primary care physicians with these symptoms, if you're not specific, even if you spoon feed them like I did, they still can't come up with answers. And remember that no matter what happens to you, there's a root cause. Okay. A lot of times they believe that this is a genetic disposition, like they told me, a genetic disposition. I don't think so. This is not a genetic disposition. Okay, if you have diabetes, if you didn't have diabetes, and all of a sudden you're 47 years old and you're diabetic, and you have anxiety and high blood pressure, it's not a genetic disposition. You did it to yourself somehow. You have to get to the root cause of that. So physicians, especially in primary care, they need to learn how to not just treat symptoms, but to deal with the root cause of things, like with me. And I'm telling them the situation. All they have to do is like maybe go to an ENT doctor. Something's going on with your sleep. The ENT doctor can maybe give you a sleep study. No, I had to figure things out for myself. 2 years I suffered in the hands of these primary care physicians. Finally, I was able to find a good doctor. I found the amazing internal medicine doctor that knows how to supervise someone's health. And obviously with my expertise, then I can use them, and together we can work together to make sure that I stay healthy. I found an amazing cardiologist. I found an amazing ENT doctor that can tell me exactly what's going on. And maybe later on I'll have a sleep study. And I also find an amazing orthodontist. So I'm going to find solutions, and I'm going to provide these solutions for you too. Exactly how I deal with my sleep apnea. But currently my blood pressure is under control. I have zero anxiety whatsoever. I feel no anxiety. I feel 100%. And one of the reasons that I'm coming up with this channel is, if you see, since I'm in the field of electrodiagnostics, I do lots of trainings, and I talk a lot about when it comes to the peripheral nervous system, which is nerves and muscles, and I also have a lot of experience when it comes to other areas of medicine. So we're going to talk a lot, and together the objective of this channel is for me to stay healthy and then help you stay healthy. But anyway, guys, if you found this information helpful, please share this video. It will definitely help my new channel. Subscribe, turn on the notifications, and I'm going to try to take out a new video once a week. And with that being said, I'll see you in the next video. Bye bye.